Hi, everyone, and welcome back to the Horizon Line, a podcast brought to you by Horizon Behavioral Health, where we dive into real conversations that matter. I'm your host, Ryan Weeks, and today I have two special guests with me. I have Dr. Sara Bailey from the University of Lynchburg. Hi, Sara.
Hi, it's good to be with you.
And I have Jennifer Smith-Ramey from Horizon Behavioral Health. Hi, Jennifer.
Hi, Ryan. Thanks for having us.
Thanks for being here today. Sara, do you want to take a moment and just introduce yourself to the audience?
Absolutely. My name is Sara Bailey. I am an associate professor at the University of Lynchburg, where I am the Counselor Education Program Director. I've been there since 2019. I'm also a clinical mental health counselor. I have a small caseload of clients, North Carolina clients. I work with clients who are experiencing anxiety, concerns related to aging, adoption, addiction, career concerns. And I work with a practice in Winston-Salem, full life counseling and recovery. And I am so glad to be here and glad to be talking about women and substance use disorder.
Thank you for being here. And Jennifer, do you want to introduce yourself?
Yes, absolutely. Jennifer Smith-Ramey with Horizon Behavioral Health. I've had the wonderful fortune of being with Horizon for going on 20 years now. Overall, I've been in the public behavioral health field for 30 years. I'm a proud public servant. In my role at Horizon, I work with grants and programs. I have a wonderful opportunity to collaborate with stakeholders and partners in our community to identify gaps and needs in our community and then develop programs to try to fill those gaps and needs. In terms of other professional background, I also teach future counselors and future professors. I work for the University of the Cumberlands, and I teach master's and doctoral students there. So it's a lot of fun. Love the variety, having a variety of activities and things to do. And then lastly, I serve as a consultant and trainer for an evidence-based substance use disorder psychosocial treatment called Adolescent Community Reinforcement Approach. That's a mouthful. We call it ACRA for short. And that's a model that we use in Horizon with our youth and our young adults.
Thanks for being here, Jennifer.
My pleasure.
Yeah, so obviously we have two very experienced and knowledgeable guests here today. So I want to just dive into, we've been talking about Women's Health Month. We've been talking about mental health, a little bit of substance use too. So I want to dive into those topics a little bit more and also speak to ethics in the profession. So Sara, my first question for you, what do you think makes addiction different for women compared to men?
An important question, especially during this month. I think it's important to consider men and women as unique in the sense that women's experiences in the world are often very different. As a woman, access to treatment, the amount of research done on women's concerns related to substance use, family concerns, caregiving concerns, biological concerns. For example, when a woman takes a drink of alcohol, it will affect her differently than a man of the same size. Also, there are stereotypes and bias that come into play. We think about women and substance use, and we may think anything from mommy wine culture all the way to she let her kids go because her addiction was more important. And so women have additional pressures on them that are unique, from the day-to-day in person to social media and other pressures externally.
Jennifer, do you have any thoughts on that question too?
No, I certainly would echo what Sara has shared about the differences in gender, and that really informs at Horizon a lot of our treatment options, and we may touch into treatment later during our time, but we feel like it's very important to have gender-specific treatment for women. And I'll give an example. Here at our Horizon Langhorne Wellness Center, we have women's intensive outpatient group. So that's important for women to have a place where they can share these specific issues and get support specific to their needs and tailored to them. So that's something that we've worked to establish within here, and we hope to expand that. Bedford's our second largest location. I was just talking with our manager, and that's an area that we hope to expand there as we have a women's recovery residence located in our Bedford community.
That's great. That's great that we have those resources here. Sara, you're going to do a special teaching tomorrow for our staff and the public. It's called Her Storical Healing. Can you speak just to Why is it important to look at a person's history, and how can that help in treating addiction?
Such an important question. And self-disclosure here, over the past several months, I've been digging into the history of women and substance use and perceptions. And that has really informed me, even in my own clinical practice in the time that I've been preparing for this talk. I think we can all agree that knowing where we've come from is important as we plan to move forward. And I think when we're talking about women and substance use disorder, I think it's important to reflect on how we got here. For example, when we think about women and opioid use disorder, which is a significant problem in Lynchburg and across the country right now in 2025, if you consider the late 1800s, so we're talking late 19th century, turn of the 20th century, the most commonly experienced opiate use disorder was someone who was white, female, and middle or upper class. So high SES, female, potentially partnered, potentially raising children. Women at that time were prescribed opiates for all kinds of things, specifically, and I put this in air quote, women's concerns. And from that time until this time, women are prescribed opiates at a higher rate. And so knowing that this isn't a modern phenomenon, that this has been going on for literally centuries now, can help inform us of how careful we need to be in assessing, in screening and assessing, and then treating women who may be experiencing that disorder. Additionally, I think we need to look at how women's bodies have been often objectified, have been classified as appropriate or not appropriate, because a lot of the substances that women were prescribed over the years also had to do with the way their bodies operated or looked. And I won't give it away today, but I will share something that kind of shocked me when I was looking at diet culture and women from the turn of the 20th century. So I think reflecting back informs us as we plan treatment, as we plan opportunities for prevention, especially primary prevention, because women historically have been influenced and impacted by substance use and by attitudes towards substance use. And oftentimes how we behave today has a lot to do with how we were taught when we were younger. So even in a more short-term kind of way, I think knowing where we started can help us move forward in a direction that we wish to go.
And how do you think that past still affects people today? What trends are still ongoing?
Well, I think pigeonholing women into certain categories. I think especially now, if you look on social media, something as simple as and this is so bizarre and kind of out of context perhaps, but glass skin is a thing. And Jennifer, you probably have seen this on social media. The idea that to be beautiful, you must have perfect skin and it must be poreless. Well, that's not a human. We have pores. We all have pores. Without them, we would not be around. But those sorts of pressures, I think, have always been present in women's lives. And although women have a lot more power, political power, financial power, decision-making power, those trends have not stopped. And so contextualizing those and recognizing the pervasiveness of them helps us take them more seriously and helps us honor the lived experience of women who are experiencing some of the same things today that we might have 100 or so years ago.
Going off of that, Jennifer, I'll field this question to you as a director of programs here at Horizon. What are some signs that a treatment program is actually designed with those issues and women in mind?
Absolutely. And as I mentioned before, if you can have gender responsive, gender specific tracks. Like I said, we have an intensive outpatient group, and that's important for women to have some cohesion and identification with other women. So that's certainly one reason in terms of group therapy why that might be important, that the women can work together within a group setting. Within our individual therapy setting, that's important for our therapists, our clinicians to understand, the gender specific needs that Sara talked about that our women may experience. And another important factor is trauma-informed care. We know that 70% of women with a substance use disorder or SUD have experienced some type of trauma. Either it could be a simple trauma, complex trauma, and that can range from verbal abuse, physical abuse, sexual abuse, a combination of those. So that's very important as treatment providers that we're providing care through a trauma-informed lens. And fortunately, there's a lot of great research and data out there. For example, the Substance Abuse Mental Health Services Administration, or SAMHSA, has 6 key principles of trauma-informed care. And we at Horizon, similar to our other community service boards, train our clinicians. They're required to get 40 hours of trauma-informed care every 2 years. And so that's something that we really feel is important, that when we're interacting with a client, it could be from our admissions, where we both came in at our admissions office, from that waiting room. That needs to be a trauma-informed waiting room where there is safety for our clients, they're treated respectfully, they have access to care. So we really emphasize trauma-informed treatment. And I can talk more specifically later if we have time about some evidence-based trauma-informed models. Actually, I should mention, because she's coming tomorrow to speak with Sara, we have Dr. Lisa Najavitz, who is out of Harvard and is a researcher and developer of a trauma-informed women's model called Seeking Safety. And that's a model that we've used at Horizon for many, many years. So that's another important point, is when we're working with women, and this applies actually more broadly to just women, but that we're using evidence-based care. We want to use the latest research. We want to use models and approaches that we know work and we know produce effective outcomes.
And obviously you keep learning, right? There's different methods and different treatment options being developed all the time. So you're both professors. How do you kind of balance teaching future clinicians and also doing clinical work at the same time?
And you're exactly right. We should always be growing and evolving. It doesn't matter if we have a PhD or if we have a bachelor's degree, or if we, maybe an individual with lived experience that works as a peer. We should always strive to stay abreast of the latest knowledge and research. And research changes and it evolves. And I'll give an example. I came out of graduate school back in the 90s. My kids always say back in the 1900s. And at that time, going into my first public behavioral health care organization to work, substance abuse and mental health treatment, or substance use and mental health treatment, was very siloed and segmented. So I remember the agency that I worked for, there were separate waiting rooms. So you either went to the substance use waiting room or the mental health waiting room. And at that time, I was identified as a mental health clinician, and our waiting room was very nice and bright and airy. And the substance use waiting room was like around the back of the building. It was kind of dark, and we were always like, well, what goes on back there? And I mean, to your point about stigma, I mean, that was stigmatizing to those clients. At that time too, there was maybe not pervasive, but there were still some thoughts that treatment, you had to be very judgmental and, aggressive with your clients and kind of get in their face and tell them all the ways that they've messed up, and very, very treatment. And I'm so glad to say that our field has evolved, and we see now that that's not a pathway for long-lasting, sustainable, healthy change for people. And I'm not saying that no one ever got sober back then, but through the research and the science, we've really seen that connection and relationships is a key. And that connectivity is between counselors and clients, as well as the clients and their community. And that's another aspect that's so important for our women, is that they develop a sense of community. We want them to see treatment not as something that's necessarily long-term, although recovery lifestyle is long-term, but we'd like to see treatment as something shorter term so that they can then be in their community developing those healthy relationships and what we call healthy prosocial non-using activities. So that's really, in my work with students and then supervising clinicians here, some things that we really heavily focus on. And I know when I'm in the classroom, one of the things I like to do is bring in other people that can share their experience too, either folks with lived experience like peers or other clinicians. I think that's really important for the students to get a nice eye to see what the real experience is like within the community settings.
I love that, Jennifer. To tag along with that, I think the community aspect for women is especially important. I think women, we tend to be relational in our lifestyle and our behaviors. And so I think that's really important. And Jennifer, you and I are both women, and we're educators and we're clinicians and we're supervisors, and we have a lot of roles. And I think looking at individuals holistically is so important. To look at just the two of us have so many roles and we wear so many hats. And Jennifer, you were sharing earlier, you have a young dog, and that may not seem like a big deal, but that's part of your lifestyle. That's part of your value. That's part of what you see in the world as important. And I think when we're working as professionals ourselves, teaching students who will one day be professionals, I think it's important to share not only the content knowledge and the skills that they need, but also to remain humble. I never speak into a room presuming I'm an expert, because I'm not. The only area in which I am an expert is on myself. I have expertise, I have knowledge, I have skills, I have awareness. And as an educator, I attempt to demonstrate that humility. And there are often questions that students have, and the answer truly is, I don't know, because no one can know everything. I think remaining active in a clinical space as an educator is really important. I think it helps balance out some of the siloing that you mentioned in another context earlier. I think that's important to kind of integrate those two things and to bring a variety of experiences and perspectives into the classroom. I think that's essential in developing a culturally humble clinician. And also to kind of keep us on our toes. Like, I'm always learning. There's not a day that something doesn't catch me and kind of draw me down the rabbit hole. Even preparing for this talk tomorrow, gosh, I've learned so much. Things that I kind of had a little awareness of, but have really expanded on. And I think in the clinical space, as well as an educator, that curiosity is really important, and to maintain that sort of wonder of all the things we can keep learning. And I think that as long as we hang on to that, I think we'll be consistent and productive in our fields, and also actually enjoy what we do, which is essential for this work.
Yeah, and we've kind of focused a little bit on the person-centered approach. Do you want to speak to ethics in the profession too for a minute?
Well, absolutely.
Yeah.
Absolutely. There are a lot of different perspectives when it comes to ethics. Some people conflate ethics with law. That is not the case. Ethics and law are very different. Sometimes there are conflicts between the two. Ethics are not the same as one's personal values. I may have a set of values that are in misalignment with my professional ethical responsibilities. But as a counselor and as a counselor educator, there are certain ethical standards by which I am committed to abide. If those conflict with a value or a sense of right and wrong in my personal life, I have to do something called bracketing. Bracketing doesn't mean that I'm ignoring who I am, because who I am is in the classroom, it is in the clinical work I do. But my awareness of that, my awareness of, I'm having feelings about that, and taking a moment, taking a breath, reflecting, and then coming back to my main purpose, which is to provide appropriate care to my students and to my clients. Remaining person-centered and remaining an ethical practitioner really go hand in hand. When I view a client, for example, who comes with a particular set of concerns, I want to view them holistically from a biopsychosocial approach, trauma-informed. I presume trauma in every client I ever meet. I presume that. And if they have experienced any level of trauma, that will come out in behavior. That will come out in their feelings about themselves and the way that they connect with others. If I'm making a decision about treatment planning, for example, I'm looking at that. I'm considering my ethical mandates. Am I honoring their autonomy? Am I not engaging in harmful behavior? Am I engaging in behaviors that will support their needs? Am I being truthful? Am I being consistent? Am I being just? Am I being fair? Those decisions come up every single day with every single client, maybe not in a structured kind of way. And something I'm going to talk about tomorrow is the challenge of upholding ethical standards when we think about them as this list of things to do. I think there needs to be more of an integrated, again, person-centered approach to considering ethics as part of what we're doing, not outside of it, but part. And if we take time to really look at our ethical standards and look at the codes and look at the requirements and consider those more holistically, again, and attend to them on a person-centered case-by-case basis in consultation with others. We cannot do this alone. I think we will offer better care for our clients, and I think it will help us sustain more long, healthy careers for ourselves. Ethics are a supportive framework within which we can do everything that we do. Oftentimes, ethical decision-making, in fact, I'd say most of the time, it's not one side or another, good or bad, wrong or right. It's complicated, it's gray, it's in the middle, which I think makes it interesting and exciting. It frustrates a lot of my students because I say it depends a lot because, and as my graduates, when they come back to talk to me, will confirm, it does depend. And so I think ethics are cool to talk about and to dig around. And that's why I'm really excited about tomorrow.
And we were talking before the podcast. Sara did a ethics talk last year that was just phenomenal. And one of the takeaways, the message that she shared with the attendees was that pause and take a breath. And I think that's so impactful because as clinicians, sometimes we want to go ahead and solve it. Let's solve it. We don't want to sit with that discomfort or that ambiguity. So I thought that was, is such a great message. And really, I wanted to highlight that, just that pausing and taking a breath is just so important and so helpful because no day is ever the same for our counselors and our clinicians. And we can look at our schedule and say, oh, I know what this day is going to look like. And then you get that phone call or you get that walk-in or even your scheduled client might share something with you that then touches into an ethical dilemma. So just that was such an impactful message. So I'm so glad that you've reiterated that on this podcast.
Okay, well, my last question for you both then is, what gives you hope right now in addiction recovery and treatment, and where do you think the field is heading next?
Recovery is possible. That gives me hope. And we know that as researchers, we know that we've seen the data change on the opioid overdose numbers. We know we still have a ways to go, but we know that treatment works. We know that the evidence and the research says that offering a continuum of integrated care is effective. One great example that gives me hope is the inclusion of our peer recovery specialist into the substance use disorder treatment and recovery continuum. Peers are so powerful. These are individuals with lived experience. It could be lived substance use and or mental health experience. And they can relate and connect with our clients in ways that we as counselors or clinical social workers, psychologists can't. By nature of their role, they can walk alongside clients in a different way. They can share their own story. They can serve as role models. They can help connect our clients to those community resources. And we've just seen such great outcomes with peers and integrating them into treatment and recovery from the beginning point of treatment, from engagement. Peers can help clients that may be ambivalent about treatment because of stigma, because of other barriers, transportation barriers, financial barriers. Our peers can help walk alongside those clients. And then peers can also help keep clients in treatment, because that's something that our field struggles with is retention and session attendance, and the peers can really just be a strong asset to keeping folks in treatment. So those are some of the things that give me hope. I could probably go on and on, but I want to make sure to have time for Sara to share as well.
I love everything you just said. That gives me hope. As you were speaking, a couple of things came to mind. One was, this is going to be kind of nerdy, neuroplasticity gives me hope. Brains can heal. And oftentimes the disease of addiction can wreak havoc on a brain, but brains can heal, and they heal best with support in community, in collaboration with others. Adjacent to that, in my clinical work, the clients I've had the privilege to serve over the years who are looking to enter into recovery, who are maybe not really interested in recovery, who are maybe curious about recovery, and who have been in recovery for decades, are some of the most creative, solid, funny, interesting, dynamic humans I've ever had the privilege to meet. That gives me hope. When someone is able to smile in the face of a devastating situation, if someone is able to find humor in what feels like the bottom of their worst day, when they're able to see that spark, to have that spark within them, and then in community with others are able to light that little fire that turns into something bigger. I've seen it happen. I believe it is possible. To your point, Jennifer, recovery is possible. Recovery is cool. And witnessing the lives that people can build for themselves in recovery, that gives me hope.
Well, thank you so much for being here, Dr. Bailey. Thank you for being here, Jennifer. Anything that I missed? Anything you want to mention before we close out? I
think that you've done a great job of guiding us through the conversation today. I can't think of anything else other than, of course, we want to encourage anyone in our community, women or otherwise, that may be struggling or having challenges to seek help, that help is available. Horizon, certainly we're here in Central Virginia. There are other providers and other options for treatment too. I think Sara said it earlier, one size doesn't fit all. So there is not one path that everyone will need to walk through for recovery, that it's very individualized. But we certainly encourage people, if they're hurting or in pain or have needs, to reach out.
Yeah, I second that. I think if you are hurting or in pain, be courageous just a little bit longer and let someone know. Let someone in. Sometimes it's a conversation, it's a hug, it's a chance encounter. If we are all out there in the world creating space and being an open, receptive, empathetic ear to another person, you never know when that person's life may start to change.
Well, thank you both for being here today.
Thank you.
Thank you so much.
Thanks for joining us on the Horizon Line. If today's conversation resonated with you, we hope you'll take a moment to follow or subscribe to the podcast wherever you're listening, and that way you'll never miss a new episode. You can also stay connected with us on social media. Just search for Horizon Behavioral Health on Facebook, Instagram, LinkedIn, and YouTube. For more resources, upcoming events, or to just learn more about our services, visit us at horizonbh.org. And remember, keep your eyes and ears on the Horizon Line. We'll see you next time.